Welcome. I'm Julie Thompson, Executive Director of PACTV, and today we're hosting a COVID-19 update for the town of Pembroke. We're hosting these forums every Tuesday and Thursday at 9 a.m. for now. That may change as circumstances change with the phased reopening. Watch in Pembroke on Comcast Channel 15 or online on our streaming channel by visiting pactv.org/live. To ask any questions during this forum, please email them to pembrokeinfo@pactv.org. And for the forum replay schedule and additional Pembroke meeting coverage, please visit pactv.org/Pembroke. Sabrina Chilcott, Pembroke's Assistant Town Manager, will moderate the forum and will introduce the participants that are contributing today. Welcome, as usual, Sabrina.
Thank you very much, Julie, and good morning to you.
Good morning.
It is Thursday, May 14th, guys. This is exciting stuff. The governor has us slated for a phase one introduction on after Monday. So beginning Tuesday, May 19th, we're going to start to see some subtle changes, but there's an important notice that we should all be ready for. We should all be standing up for. And that's to start to put ourselves back into the mindset of rejoining our subsections of society. You're going to see and hear from what we're slowly hearing out of the state that some businesses are going to be able to bring their employees back. They're going to be setting up proper protocols that will be self-certified for a variety of different things that we're going to talk about in a few minutes. But employees are going to start to get dressed in the morning and prepare and go back out on the road and travel to an office. And of course, those are the ones that cannot safely work from home or productively contribute to their company's end goals by working remotely. And that actually will cover a good segment of the Pembroke population. So as some of those thoughts enter our minds and we think about the days where we were, straight and narrow, law abiding, we were getting dressed, we were going out, we were putting on our best foot forward face and greeting the day. Suddenly, as this whole period of time staying at home ends, we have to adjust to that mindset and start thinking about that. But before we introduce the folks who are on today, and thank you, we have had a myriad of questions coming in from businesses, from residents in Pembroke, some of the things they want to see and the things that they hope to see. Now, just to get us started, today we are joined currently by Health Agent Lisa Cullity and
Hello.
Operations Lieutenant Rick MacDonald from the Pembroke Police Dept. Good morning, you guys.
Morning.
Morning, Sabrina.
We are anticipating that Interim Chief McCormick will be joining us shortly, but for the moment, there's so much groundwork to lay on what the governor has said since we were last here on Thursday. Lisa, can you get us started with some thoughts and some early indicators of what phase one will look like?
Sure. How many hours do I have? No, I'm just kidding. I think the high points, if everyone takes a look at the governor's website, which is actually pretty simple, it's actually shorter and more concise than I expected it to be, which is wonderful. But it's right there. It's on the COVID page. It's under the fourth phased reopening, is the expectations. There's a couple of things I want to point out about those expectations I found particularly interesting. The first one is that all phase one businesses shall. Language was very clear of what is expected. It's not optional. It's not, I'd like to. It is what is expected of a workplace in order for employees to safely return to work. Things like hand wash stations, sanitization, cleaning schedules, social distancing when possible. The requirement, very important word there, requirement of facial coverings in those private businesses. So I think that any employer that is open now or is thinking that they might be part of phase one, we don't know what phase one looks like yet. The governor has not said what businesses are included, but it would serve that business owner very, very, very well, or that office manager very well, to be taking copious notes off of that website and complying. Now, hand wash stations are relatively easy. Most businesses have a bathroom already that would be available to the employees for hand washing stations. Second really important part of that statement is that sanitization is required, meaning it's great if you have a bathroom, but you better have some soap and hot water available there and or hand sanitizer. Those would meet the requirements of sanitization. Just having a bathroom with cold water, just having a bathroom without soap will not meet the requirement, and it would be a cause for there to be a violation there. The requirement of facial coverings. Obviously, people with medical considerations can be exempted from that, but all other employees, facial coverings would be required. Managers are going to have to think about how they're going to handle that issue. Another key component that business owners should really be focused on in that order, in the order of openings, is how a business or an office manager is going to handle COVID-19 positive employees. The order does not say specifically what you have to do. It does say that COVID-19 positive employees or people exhibiting the symptoms consistent with may not work. They're very clear about that. And they're very clear that after any employee has tested positive, that the corporation, company, business must have a cleaning protocol and must have a written protocol in place for employees to return to work. So I guess what I'm nicely saying is, if I was a small business or even a larger business owner thinking about my return to work items, I would be getting together with HR and getting this written out really quick, so that it is available, so that I am compliant. The minute the governor says I can open, I will be able to hit the ground running, rather than behind the eight ball trying to write personnel policy and properly post it. Signage regarding social distancing is also a requirement under this. So again, I would never tell a small business owner what to do, or any business owner what to do. But if I did own a business, I'd be spending some time looking at this right now and getting everything in place, so I'm ready to go as soon as I can.
All right. So, Lisa, just to summarize or encapsulate some of the things you just said, there seems to be guidance surrounding what needs to be done if you're in the list of industries or businesses that are included in a phase one reopening. But I get the impression, and I have been listening as closely and carefully as I can, that there hasn't been any guidance yet on what those types of businesses will be. So to circle back to some of the questions we've been getting, and I appreciate that if the state didn't tell you and the state didn't tell us, I don't know how you'd know it, but maybe you do. So
we can go with predictions again.
I was going to say, types of industries that people seem to be the most interested in are going to be the ones that are probably the most problematic. Light industrial is one of those things people don't realize they might need, but could be included in phase one. But Lisa, there's a lot of questions around things like restaurants. People are very interested in not only supporting their local businesses and trying to make sure that their friends and family and their favorite establishments stay solvent. Do you anticipate that a restaurant would be in a phase one scenario?
I don't anticipate that, but there's two problems with predicting, the different phases and what will come online. And the first problem being that the governor has said over and over again, and doubled down on it yesterday, that he is not making any announcement of any types of businesses till Monday. This concerns me, because if he's not even going to announce the types of businesses till Monday, I don't see how that means those businesses are going to be open on a Tuesday. I'm thinking he's going to pick a date a little further down the road for some of those businesses. The other thing that concerns me about the guidance when trying to pick types of businesses is that it does have a clause at the bottom of it that says industry-specific regulation will be coming. When we start talking about industry-specific guidelines, we're going to be talking about industries that always have had specific guidelines, and I think that is specifically targeted at high volume stores, and I think it's specifically targeted at food preparation and restaurants and things like that, because obviously those have always had the highest possibility for disease transmission. So gut instinct, no, I don't think restaurants being open is going to be a phase one. If it is in a phase one, it's going to be extraordinarily reduced. I've been predicting about 25% of inside capacity, where a restaurant would literally have a patron at every other table at the most. I think that outdoor seating is going to try to be allowed to be opened sooner before that, but a phase one, I don't see it. And I don't see it because I don't see the guidance out yet. I think when we see guidance coming out for restaurants and other things, we're going to see maybe not requirements, but certainly efforts to use single-use products to avoid contamination, such as throwaway silverware, throwaway plates, things of that nature. I hate that as an environmental aspect, but I do understand as a disease preventative aspect, it is highly effective. I think you're going to see things like no condiments, multiple use items on tables, such as condiments, salt and pepper. I think you're going to see people returning to single use, tear open, think fast food style, as unglamorous that is. Again, it's more sanitary. I really think restaurants are going to be more like a phase two project. But the other thing is, remember, we don't know what this timeline looks like. This could be phase one a week after Monday. It could be phase two just a week or two after that. We don't know how fast these phases are going to come. I'm getting the indication, because because there's so much talk around the restaurant industry that while it might not be phase one, I'm not feeling like it's really far off either, because there is a lot of push there to get them back open, even in a limited capacity.
That's actually really smart. So when you've met in the mornings at 10 o'clock with emergency management, some of these things have already come to the forefront. I know that PEMA's been working to put together templates and metrics and actually create a flow for what could happen as businesses really start to get excited about ramping back up. And one of the very first things that each business is going to have to do is that they are going to have to come up with their own plan that's in concert with some of the guidelines that have been given out. So I know that the town's working on creating a whole separate reopening type of a page for businesses that will include some of these items and things that are going to be required and so forth. But if I'm a business owner at home right now, what am I worried about? What am I thinking? And what is the number one thing you anticipate being a struggle?
I think the number one thing for every business owner, and certainly if I was a business owner right now, I don't want to make light of the government and government regulations, but my first and foremost concern is always going to be employee safety. Small business, big business, it doesn't really matter. If you suffer the devastating loss of the death of the employee that was made ill on the job, I can't imagine from a business perspective how devastating that would be. The smaller the business, the more devastating. So not without regard for the governor's orders and all those safety conditions and protocols put in place. I mean, that's got to be priority number one. The other thing is, as a business owner, if your work environment is not safe, if you have not done everything possible to prevent COVID contamination amongst your employees, how do you get your employees to come back to work? And as a business owner, if you don't put the maximum effort and do everything you can to ensure your employees' safety and someone does become sick, I can't even imagine what the lawsuit opportunity would be there, especially with guidance in place. If a small business owner doesn't have all those precautions in place and documented, I can't imagine there's an HR director that isn't going to assist on that for any mid-size or larger size business. Because of liability. I mean, liability is enormous if someone flagrantly disregards safety protocols. Think asbestos poisoning, think any kind of on-the-job poisoning, and the liabilities that would come along with it. I would think COVID would be no different. Now, if a business puts a great plan in place, documents everything they're doing, there's sanitization stations available, they minimize the opportunity for employees to share workspace or share workstations, and everyone's wearing a face mask and someone becomes sick, I think that the whole optics changes for that business. While the employee or their family might be mad about it, certainly if every precaution's been taken, I think that leverages the business into a much stronger, position to say, well, we did everything we could, but this is a naturally occurring disease, which is also the case.
No, that's good. That's good information. And I think it's important to note some of these small businesses don't have the depth of resources that the larger corporations have.
No.
But what they do have is they have insurance agents. And every single one of those insurance agents will be able to put every small business in touch with whoever handles their workers' compensation for best practices going forward. Every one of these companies, every insurer is coming up with their own CDC compliant. And again, it may vary state to state, as you've pointed out, but they'll have a template of their own at no legitimate additional cost. These are going to be mitigating losses. So their own resources in place now. Just call your insurance agent, partner with them, get a hold of whoever's putting out your best practices for your workers' compensation group, and start your plan and start it as soon as possible. To Lisa's point, since we don't have more information from the state, we just don't know phase 1 on Tuesday versus phase 2 whenever, and any kind of sliding scale. If phase 1 is going to allow for some specific industry standard a week from then, you're going to want to have these business owners moving toward that goal before they can even consider taking that step. And just as a quick follow-up before we say good morning to Ken, some of these phase 1 options, as a matter of fact, I think everything we've read, do not, for the most part, include full and unfettered access to the public. So This is a plan to reopen businesses internally and get their structures back to what they were. Is that correct?
That's the impression I'm getting. We don't know anything for certain. I mean, the governor could come on Monday and surprise us all. But no, I think that the reopening is going to be focused on businesses that have minimal public interaction, simply because it's safer. I mean, any business reopening Tuesday and just having anyone walk in off the street, obviously there's an immediate liability to their employees, if they have not figured out how to socially distance and how to keep that work environment as safe as possible. I would imagine phase one, again, I'm trying to predict here. I think phase one is going to be shorter. I think phase one is going to be for businesses that don't have a lot of off the street or customer interaction that is unplanned. And I say that because I'm not talking about attorneys that have, one-on-one meetings without the overlap of visitors, or doctors that would have that. I'm talking about businesses that have a general open door where anyone walks off the street and conducts business. But I think that to your point, that is the opportunity to bring staff back in, assess the workplace, make any minor changes, get prepared for those businesses that will be accepting people off the street or the public entrance, and to be prepared for that. And I think phase two is when we're going to actually see the public going into businesses that they have not gotten into for so long. That's why I just have a feeling phase one might be on the shorter side. I don't think it's going to happen Tuesday. I think it's going to happen shortly after Tuesday. And I think you're going to see that phase two, which is going to involve the public going back into those businesses, I'm going to guess about 2 weeks afterwards, and at reduced capacities. I don't expect any business of any size, scope, significant scope or scale to just have a wide open policy. They also have to address the regulations they've already put in place on supermarkets. That if the numbers are going to be reduced, does that apply to supermarkets? They're going to have to address that. Or if their regulations are less restrictive, are they going to lift some of those restrictions on supermarkets? So we'll have to see what that looks like.
No, very good. Thank you. So just before we get to the actual Tuesday activities that are happening on the 19th, because Pembroke has a humdinger coming on Tuesday, I wanted to ask Deputy Chief McCormick, there is, as we were just talking about, a beginner's framework, waiting for those final guidelines from the state on how to assist businesses as they move through phases. And there's going to be a lot of unorthodox, quick ramping up to support some of these structures. And I know emergency management, I think, had talked about partnering with some of the boards in town and trying to determine an expedited process to think outside the box a little bit on a temporary basis. I know the planning board specifically requested that you be present as soon as they're at their next meeting. Can you just explain a little bit about what the thoughts are? I know that you're not setting anything in stone, but can you just throw out there what that loose concept may look like?
Yeah, so we're hoping that, our whole main goal is to get businesses open and people back to work. That's been the goal all along. So we're hoping that we can streamline the planning board, zoning enforcement, fire department, police department, board of health, with maybe just a quick checklist of things that need to be accomplished. Some of them may not be accomplished, but it would be incumbent upon the business owner to kind of self-check himself to make sure that he's ready to open, and then kind of submit a permit. If we're all on the same page, we'll shoot an email out to everybody. If we need to go out and inspect, we'll go out and inspect. It's something we're working on in the fire department right now, at how we're going to accommodate that. Obviously our runs are increasing a little bit more now. I don't know if it's because people are a little bit more comfortable, or the masking up thing is working out well, and more people are getting out, or people are just getting tired of staying home. But our run volume has definitely gone up. And that's the process. We're hoping that, we can get these businesses back to phase one, phase two, whatever it may be, get them open, make it as painless as possible, just try to help meet whatever the new normal is, just try to get there and do it safely.
Thank you. Thank you very much. All right. So the elephant in the room is Tuesday. Sorry. Tuesday, Pembroke joins the other towns in this district in holding an election to fill the state senator seat. And that was an election originally scheduled back in March, pushed forward to Tuesday, May 19th. So the towns had to accommodate and make some looks and plans. And if everybody remembers, there was a very public vote by the Board of Selectmen to consolidate the precincts that did not work out. That was rejected by the Attorney General. So we're pushing the language about, or the message, that everyone will vote in their regular polling locations. The good news on this particular election is the staggering volume of absentee ballots. So many Pembroke folks took advantage of voting by absentee ballot. and the clerk is sitting on a high volume. So anticipating what could happen for voter turnout, arrangements are being made in each one of the 5 precincts. But the towns had to take a look too at what are the rights of the voters, what are the rights of the folks who are there, what is the safest way to approach it, and actually dedicate custodial staff and do a little bit of a different staffing mechanism at each polling location. So many of the election workers are in fact in a higher risk category. So this is ultimately going to fall, sorry, Lieutenant, to the police department to assist in supporting the election staff on Tuesday, the 19th, at all 5 locations. And I know there's been a lot of talk about that. And I know that a lot of good work's gone into trying to make sure that, masks are available, facial coverings are available, sanitizers available, that it's laid out a little differently than people are looking at. But Lieutenant, what kinds of things are you looking for? What do you hope to see in the people who come in on Tuesday? And what kinds of things do you not want to see with people who come in on Tuesday?
So first of all, I want to thank the residents of Pembroke for doing a great job. They've been really working with the program, and going forward, I don't see that being any different when it comes to the polls. We're going to set up probably these booths socially distant. And for those that don't have masks when they come, facial coverings, we'll have masks there to offer them. If there's a medical issue, we'll have one of the poll workers or ourselves escort them to an area that's socially distant so they can vote.
Very good. Very good. Since you don't anticipate a problem and you do know far better than some of the rest of us exactly what the climate is out there, you're out there every day, that should actually be a successful strategy. Now, the town will take a look in retrospect. They'll debrief that whole activity and everything that happens on Tuesday to look ahead to a scheduled June town meeting and town election. And the Board of Selectmen has to consider all of the input that they get from PEMA and from the moderator and the town clerk. But at this stage of the game, while problematic, what is the lens, Lisa, on June 16th? What do you think we're going to see over the course of 30 days? I'm, again, not forecasting, but I'm saying, is there a concept where you could start to gather in a month?
I think it's going to be very, very problematic. And it's problematic not because of the quorum. Everyone keeps talking about quorum. Quorum is an easy thing to adjust. I shouldn't say easy. It can be legislatively adjusted. The problem for communities like Pembroke and several of our surrounding communities is that we have what's called an open town meeting, where any registered voter is entitled to come forward, vote, and be represented. So that's going to be the problem, is you literally have a limitless number, borderline, I think 8,000-ish registered voters, that if they walk up and wish to participate in town meeting, you may not turn them away. And that is the challenge right there, is how can you prepare for a town meeting when you cannot possibly know what the maximum, well, you have a maximum number of 8,000-ish, but that is certainly not a number that we're going to see being allowed to gather in the initial stages or even in any phase of this, COVID situation. That number of people in a singular place is certainly not going to be allowed. I'm going to guess for months. I'm thinking this is the number that the colleges are grappling with so much in the fall, of whether or not they can bring school back because of the staggering numbers of people you'll have in tight proximity. So that's the real problem. The real problem is, how do you have a safe number of people, or if you're going to have up to 8,000 people show up, which has never happened, but nonetheless could, how do you space them appropriately? I've heard creative ideas such as having town meetings in open stadiums, in open areas where you can really socially distance. That would be a possibility. Problematic, but a possibility. The auditorium that we traditionally use at the high school, I know what that capacity is, but then when you add in 6 foot of social distancing around each chair, that brings that number down to less than a sixth of its normal capacity. That obviously isn't going to hold that many people. I've heard creative ideas about remote participation, not involving remote from home, as there's no platform that can handle 8,000 people, but rather using multiple rooms within a school and using the AV system somehow. And that gets really problematic for the moderator in vote counting. They would need a lot of tellers. So I know that's an idea that the moderators are working hard on and sharing a lot of ideas on. But if I look at it purely through the public health lens of safety, I don't see town meetings happening for months, not safely.
Understood. That is absolutely a challenge when we're looking at today's data, trying to project it forward 3 days, 7 days, 14 days. That's where you start to see the whole drop off. You just don't have enough. This has been a really fast cycle of ramping it up. So to that point, business in local governments and around our local communities across the state are going to start to see in phase one that return to staffing. Maybe closed to the public, not unlocking a door per se, but doing a lot of drop-offs, pickups, trying to schedule appointments for potential one-to-ones on those situations that just don't fit in a cookie cutter type mold, and employees coming in and learning the new way of doing business with their coverings, their sanitization, their business plan. So now you have a return to volume, right? These small businesses, government operations, it was all, well, no, that's been pushed down the road. Because it's non-essential. So now there's this gray area. Briefly, the deputy chief alluded to it. If runs are on the way up, if calls are on the way up, if applications and communications and needs for services are on the way up again, or frankly, like a true need for services, but the request to actually execute them, right? That's always been that area that we've been in. Emergency management teams across the state are going to struggle. They have a return to work. They have a return to training and day-to-day operations. They have their own stabs to take care of and make sure everything's implemented. And then they still have to come together as a unit because this phase one does not lead to a 2-3. It could lead to a close 1, 2, 1, close. There's a predictor that this is going to come back around again in these bedroom communities where we may not have really seen the full results. And as things open, it's going to come closer and closer to some of the suburbs. So I know that was a very big setup for a very simple question. Sorry about that. What steps does emergency management think they're going to have to take in order to stay on top of it, to stay involved and in tune, but almost to throttle back? Is there any breakout groups? Is there any way of trying to balance emergencies with routine? And I'm not entirely sure who to start with. I apologize for that. But I think Lisa's smiling, so we're going there first.
Lucky me. It's impossible to predict. And I'm not going to try to steal the governor's thunder, but I think it is easy to copy a well-laid plan. The plan has to be nimble. And trying to predict what that plan is going to look like or how even we're going to react to it is next to impossible. This is still an emerging infectious disease. I find it interesting, as much as everyone talks about COVID, no one seems to be really bringing up that point anymore. We don't know. The best minds in the industry do not know what this is capable of. Are we going to have a second flare in the fall? Is not having people socially isolate as well as they are now, i.e. starting to open things up, going to lead to secondary spikes? And the reality is, and no one wants to hear this, but I'm not doing my job if I'm not being practical and honest, is that yes, these things could happen. These secondary spikes could come. And unfortunately, our emergency management team is going to have to do what it's always done, which is respond to the problems as they arise. We can't be sure exactly what's going to happen. Is there going to be a breakout group to specifically address business reopening? Yes. Is the Board of Health going to have to change some of its workload and how it does things to try to do 3 jobs at once? Yes. Can I say for sure that this phased reopening is going to work? No. Can I say that we won't go to a phase 1 and back to a phase 0, if we want to call it that? Yeah, I think that's a possibility. We could go phase 1, 2, 3 and be fine. There's no predictor there. We could be phase 1, 2, 3, have everything open, have a wonderful summer throughout July and August, and then suddenly kids go back to college or back to school and we start to see those cases spiking again. No one knows for sure. I do know there's people a heck of a lot smarter than me working in labs across the country trying to get to the bottom of this thing. But until we have more data, there's no sure answer. And until we have a vaccine or at least a protocol therapy that really seems to work on most patients, I think that the opportunity to go back to social distancing and things like that is just always going to be on the table.
Okay, this is something I didn't actually warn anybody was coming, so God forgive me, okay? But But were these models in the district as people went through their emergency plans, right? Were these models designed to go on for months? Is this practical? And is there a concept in the state? I know you're on these calls, Lisa. DPH has to be discussing some of these things, some of these longer range factors, right?
Yes.
How do you keep this going ad infinitum? How do you keep it going because you know it's coming? Like, at what point do you start pulling different levers? And I don't mean to put that all on you, but I'm sure this can't be the first time you've heard it.
No, it's not. The problem with any kind of infectious disease like this, and I have to be horribly practical here, is from a medical standpoint, can we socially distance and do all these things forever? Yes. Can we do it from an economic standpoint without a complete economic collapse, without people going bankrupt, losing their homes? No. And that's where you have the two worlds colliding. And this is what we're seeing displayed on social media day in, day out, ad nauseum, causing a great deal of frustration with all people. How do you balance protecting human health and safety versus economic health and safety? And one is not exclusive of the other. Unfortunately, in the American system, our healthcare is tied to employment. And right now we have a record number of people unemployed. That's not good. We also have a disease that we don't know enough about to know exactly how bad the fatality rates could get if left unchecked. We don't know how bad that is. I know a lot of people feel it isn't that bad. I know a lot of people believe it could be a lot worse if completely unchecked. And then you have the horrible conversations going online of the value of a human life. You have the argument that, well, it's just some older people dying. Well, we know that isn't factually true. And then we have some people of, well, they could pass away anyway. We know that isn't necessarily true. We have the argument, well, the numbers are really inflated. We won't know until the event's over just how accurate every number is there tracking the fatality rate or the infection rate for that matter.
No, and Lisa, that's a really good point, because one of the things people sometimes fail to take into consideration, and I don't like using that general broad spectrum people, but all of us, me included, forget that this has literally been a 90-day curve. Maybe we could say 120-day curve.
Right.
But when we start, drilling into detail and talking all, as though we have really strong knowledge of flu, or some other, disease we understand, or virus, we understand that that's had 50 years, 100 years to be studied. Correct. With the
even the Spanish flu. Everyone keeps going, Spanish flu, Spanish flu. Yeah, but we've had 100 years to Monday morning quarterback the Spanish flu. And if they had known then what we know now, how different would it be? But again, we're less than 90 days into an event that we just don't know enough about. And I think it will be a year or two before we're going to have really solid data. It could be longer than that, if ever, that we have a vaccine or a therapy protocol for it. And that's where the problem lies, is just how much loss of life is acceptable. And that's the situation. It's easy to criticize the governor or the president and say they should have this and they should have that. The value of a life, or in this case, hundreds of lives, thousands of lives versus economy. So it's very easy to sit back if you're unimpacted by the disease, from a loss standpoint, and say, but my pocketbook was hurt because I lost my job, or I lost earnings, or I lost opportunity. And it's very easy to sit back and say, if you have lost a loved one, which I know so many people that have, and say that they would have done anything to have that loved one back. But that is the very juxtaposition of the horribleness of this disease. And how do you control that? And so the reality is, how to control it best is, with our facial coverings, with safety protocols, with a higher level of sanitation. And if we can all accept and operate at a much higher level of sanitation, hand washing, not sharing things, not sharing workstations, and wear facial coverings when we're going to come into contact with other people, we can soften that blow and soften that loss of life, and yet return back to those everyday things, those business opportunities, and everything else more easily. And that's an American culture problem. You know, a lot of people say China got this under control so quickly. In the Chinese culture, if anyone knows anyone that's spent time, a significant amount of time in China, they frequently have disease outbreaks. It's not unusual to see the news flip on and a bunch of Chinese nationalists wearing face masks. It's just a more accepted part of their culture. And I think the problem here in America is it's just not an accepted part of our culture. It actually flies in the face, depending on who you listen to our culture, to be asked to do something like this. They're not wrong. I understand that flies into the face of our pre-COVID social norms, but maybe now it has to become part of our culture if the priority is to reopen the country, if the priority is to get back to work and get the economy back running. Perhaps we have to adjust our opinion of social norms as far as facial coverings and our behaviors in public in order to have those other things back.
Thank you, Lisa. That's a really, really good point. And I know that's a struggle. We've heard it from the highest executive level right on down to the folks who are chiming in on Facebook. And every single person who posts is listened to. I mean, these are conversations that happen every day. No one ever has their opinion dismissed. It's well weighed, it's well debated, and ultimately compromise or decision is reached. But that's a really good point. Now, for the most part, I'm going to take a break on questions from this side, and I'm going to ask Julie what she's got. Julie?
Hi. Yeah, I have a couple. The first one has to do with someone commented on insurance. All businesses should have insurance, and they should have workers' comp, and they probably have some kind of business insurance that covers their business, brick and mortar, et cetera. But most business policies specifically they exclude communicable diseases. That's one thing that you'd have to check with your insurance agent. The other thing is, if that is in fact the truth, does that mean your workers' comp and your liability also do not cover this? So it's another whole angle that that business owners will have to look at. Also, the idea of when you come back in and you do all the things you're supposed to do, you follow all the steps, but someone still gets COVID-19. It can't be actually proven where anybody gets it.
Right.
Well, it can be, but it's pretty difficult, especially where there's so many people that can walk around with COVID-19 and have no symptoms. So does anybody want to speak to the advice you would give all small businesses or large businesses as far as how they tackle that whole insurance end?
I was going to say, Lisa, before you go, the one thing most people do have is they have property and casualty insurance, and they have some kind of brick and mortar coverage. And if they reach out to their agent, there are best practice guidelines being given out by a lot of these companies. We're receiving them every day. I mean, whether or not there's going to be a finding or a determination of liability or exposure or a judgment pro or con for whether you caught this on the job or at the grocery store or in the park, we don't know. I mean, again, maybe Lisa has better information, but I do know for resources, for businesses that just don't know how to get started, a call to your insurance agent is starting that communication saying, look, I've been closed. I haven't been affected because I've been locked. I haven't even had employees in, and now I want to bring the employees back. What steps are some best practice guidelines and documents that are available through the carriers, through the insurance companies? I would love to have those. Can you share them? And starting a dialogue with your insurance company. Sometimes we forget that our local insurance agents are a great resource and a good partner for information. I mean, as far as, Julie, to your point, liability and actual determinations and findings, I couldn't even say. But I do know we forget sometimes that our local businesses can be our best support mechanisms. And as far as what Julie was talking about in terms of contact tracing and being able to drill into locales, Lisa, do you have anything on that?
So no, you're never going to be able to say this person definitively gave me COVID. That's going to be, I shouldn't say never. It would be very difficult because there's always going to be the open-ended statement of, well, who's everyone else you had in contact with? However, I'll flip that around to where it is going to be a real problem for business owners. If you have a situation like Walmart's, the Walmart's we've seen, the Whole Foods we've seen, and everything else, where they suddenly start testing people and there's hundreds positive, that is going to be a real problem for any employer that has a cluster hotspot outbreak at their establishment. We know that the world of senior housing care is going to be changed forever by this. with what we've seen. Yes, obviously that's a very vulnerable population, but when you have such extraordinarily high numbers, I think protocols and safety standards are forever going to be changed when it applies to cares of our seniors. But to your point, Ms. Chilcott, I agree that a lot of insurances don't cover things like infectious disease. However, I did spend a great deal of time prior to this work endeavor in the payroll world, where I did work with workers' comp companies and many other insurance companies to provide those services, even to the smallest of businesses. I would be shocked, regardless of policy coverage, if there aren't workers' comp and insurance companies out there working with this language, working with this messaging to prepare something to assist their businesses. It's just good business. No insurance company is going to do well in business if they lose a whole bunch of clients. I've seen different workers' comp and insurance agents come up with all kinds of directives, guidance, and dialogue for their clients. One, because it's a value-added service, it just makes sense for them to provide it. And two, if a business doesn't survive, they lose a revenue stream. So it's to their best interest to assist these people in every way possible. Especially when they provide some of those wraparound services. In other words, not just strictly an insurance policy, which the vast majority of your smaller insurance houses do, and even some of the larger ones. So certainly reaching out to them for assistance is the smartest piece of advice I could give the small business owner. I'll be very surprised if our local agents aren't already getting information from there. There's always an umbrella company that underwrites them. I'm sure there's already dialogue, guidance. There could even be template signs and things like that coming out to help businesses better prepare to keep their work environment as safe as possible.
Julie?
Thank you, Lisa. Thank you for that. And I'm sure we're going to have a lot more on that moving forward as we do begin the slowly phased reopening of some of the businesses. This came in from a Pembroke resident. Good morning. I've noticed persons not following the requirement of wearing facial covering in businesses that are open to the public. As we've seen reported, approaching persons directly could lead to a violent response. Who is responsible for enforcement of the requirement in real time of these violators? And I suppose that would go to Rick.
So, again, we're not going to be the social police and try to make this a criminal event. Again, we're trained to talk to people and try to convince them in doing the right things. And depending on where they are, if they're inside an establishment, then we go back to the private entity and use a trespass issue. But outside, where there's multiple people, we're still talking about that. We're hoping that people use common sense. We've been seeing a lot of that even on Mother's Day, where people were in their front yards, socially distant and having conversations. So we're hoping that that won't be an issue with the police. We don't really have a silver bullet for that.
Okay.
And Julie, I do notice from some of the calls reported, because again, a lot of times to get directly through a phone line, people will call into the town and either push 0 or just escalate straight up the chain to the selectman's office. So we'll funnel complaints and requests for response back down to where it belongs, and obviously not try to take that on ourselves. That would be ludicrous. But we're hearing a lot of people applying their own judgment to things that are out there in the the public domain about what is acceptable and not acceptable behavior. So we're having some conversations, and we're trying to talk through with some people on the phone about, is it okay for a single person, a one-off teenage person, to go alone to the basketball court, throw the ball into the hoop 100 times, and then go home? Well, it could be. It could be acceptable. There's no other person. There's no one around. They're not sharing the ball. They're not touching each other. They're well out of the distance and proximity of other people. If they're heavily breathing and respirating, they're not respirating on someone. But now the problem comes in when you add additional people. What exactly was it that you saw at the basketball court? Or what exactly was it? So that we can get a handle on whether or not maybe we need to have more conversation, change a regulation, have a further discussion, or actually escalate an issue to someone who can then respond to it. So it's a good question, but it sometimes is a little broader than that. And I do thank the person who asked the question. It's good.
Thank you. And the same person also had another part of the question. And it's, why hasn't the state or local governments taken a proactive position in making public service announcements on how to wear a mask, how to not wear a mask, how to practice safe distancing, etc.? I know we've all seen people in the supermarket, they have their masks down here, or they completely lift them up to talk to someone. Anybody want to take that one on?
Lisa?
I think again, you're talking about social norms, and to expect a society who has never dealt with this issue before to suddenly get everything all correct out of the gate and to not make social faux pas with facial covering wearing, I think is very short-sighted. We talk about the appropriate way to wear a mask, and I think we've all seen on Facebook or other social media the people of Walmart about people that don't know how to wear clothing correctly. I'm going to leave that politely right there. You cannot expect in a society where people can't not wear clothing appropriately every day to suddenly, get 100% compliance out of a facial covering. And ultimately, it's going to come down to this. Everyone has to be responsible for their own well-being. If you see someone refusing to use a facial mask or using a facial mask incorrectly, if you're not a member of law enforcement and you're not in public health and somehow an enforcement agent of public health, it is not your job to enforce it, and I advise you not to. We have already seen on the news how that can go horribly wrong. So personal policing of other people should never occur. If you see a situation that looks unsafe, you see a whole group of people not using facial coverings, it should be like seeing a group of gangsters being all gangster with one another. You should turn around and walk the other way. This isn't hard. It isn't hard. If you see an aisle in the supermarket that has too many people too close together, go down another aisle and come back. You see someone not wearing a mask appropriately, go the other way. Ultimately, you're responsible for your own safety. It's kind of like speeding on the highway. The police are never going to catch every speeder, and you don't speed and then tell the police, but everyone else was doing it. These are all not acceptable cues in any way you want to look at them. They're not acceptable behavior pieces. So one, don't police other people. Let the authorities handle that. Two, put yourself in the position to succeed. You see people behaving in a way that's dangerous, avoid those people. It's not hard. There's nothing that's worth putting yourself at risk. There isn't a thing in the grocery store. There isn't a thing in any other store. There isn't any walk that's worth endangering yourself. Now I'll take the flip side of the coin. If you're going out on a bike ride by yourself, not surrounded by other people, and you're not wearing a facial covering, I think that's okay. If you're going for a run by yourself, not surrounded by other people, again, probably okay not to wear a facial covering. You're working out outside in your own yard, maybe doing yard work. I don't think you need a facial covering there. I personally take walks every day around the cranberry bogs near my house. I do not wear a facial covering. If I see another person, I turn around and go the other way. Or if there's a divergent path that I can take to move away from them, I do. Or in the worst case scenario, if there's really nothing I can do, I step far away, I let that person pass, and then I proceed on my way. Good common sense and self-protection is the best thing you can do for yourself in these situations.
And Julie, Lisa's point is 100% right. And I just wanted to throw out as a companion piece to that, your caller, your emailer, good job, because you're doing the right stuff, and thank you. We're hearing it more and more and more, and I'm very grateful for that. People in Pembroke are making smart decisions. They may be concerned, and they may have questions, just like this person does, about what would I do, what should I do, and it's not a question of being a teller or a tattler. It's a question of what's the right thing to do in my community. And Lisa's correct. You don't confront that person directly, and you do what you can to get out of that situation without having to actually be near or expose yourself. But thank you for reaching back to the town to see who you can partner with, because that is a great move. And I will assure you, everybody who gets that call or gets that email is grateful to hear from you.
Yeah, I totally agree. Thank you, Sabrina, and everybody for fielding that. The last thing that I just wanted to bring something up before you end your show is the governor's 4-phase approach to reopening is on mass.gov. And if we could bring that up in the control room, the first page shows the 4 phases. The second page kind of gives the 3 different avenues: the social guidance, mandatory safety workplace, and sector-specific safety. And then this third page that Lisa spoke to a lot about in the beginning was the mandatory safety standards for the workplaces. Now, couple all that, okay, thank you, control room, couple all that with the lack of knowledge of, okay, which business can open? Am I one of the ones? And it's not going to be a ready, set, go, I'm going to open tomorrow. There's so many things that each business, whoever you are, needs to kind of calmly take a look at, make your list. These are all the things that I need to have information about before I can go forward. And is that the watchword that we really should leave people with today? Is we don't have quite enough information right now, but there's a lot of homework that you can do. Sabrina?
Yes, Julie, there is, and thank you for that. Before Lisa closes this topic, because I can see her again, she's ready to go. It's the other aspect of phase one that was important to bring back to this table is all the people who've been home. You've had some folks that have been not disconnected, but they've been forced to connect in different ways. So we're all Zoom meeting and we're in the neighborhood watch parties and we're doing all of these electronic communications. And we've forgotten some of those basic fundamental social skills, some of those steps that you take before you re-enter society, whatever your day off was or your treat vacation. You clean, you shave, you get ready, you pack a lunch, all those boring, routine, mundane matters. And we're going back to some of those basics as we, stand up and get ready to go back and join our fellow coworkers. But you're talking industry specific, and that is truly the question. So Lisa, jump on the industry specific that I don't know.
Sure. I think industry specific is just that. I think some of it's low hanging fruit that we can easily pick up, like restaurants using single serve condiments, not having multiple touch items on a table that could be transferred from one party to another. Using disposable ware could certainly be an aspect of it. I'll go and pick on construction. Obviously, construction sanitation is extremely problematic, and I'm assuming there's going to be industry specific to construction job sites. Minimum numbers of hand washing stations, whether they be portable hand washing stations, minimized number of sanitary stations, whether that be hand sanitizer for those places that don't necessarily have hot running water. I think that could be an industry specific. I think there could be industry specific standards and guidelines regarding superstores, super centers. I mean, Walmart, I hate to keep kind of picking on them, but they're easy to pick on. Obviously, someone's going to have to address the situation with so many Walmarts having so many issues. There could be further restrictions on capacity, and that could be industry specific to super centers of a certain size. It could be done by square footage or the safe population level that's usually set, I believe, by the fire and the building department. And there could be some sort of reduction of that to 50% or less for some of those buildings so that they don't get over capacity where they can transfer disease to items and then to other people. There could be additional cleaning standards required of those super centers and those high capacity shopping areas where so many people pass through in order to maintain a higher level of sanitation. That's just me spitballing at a whole bunch of industry standards that could be very specific to a business based on what they do or the population capacity that they might see in a day.
Lisa, thank you. I'm really
I
not
just depressed you. I'm sorry.
No. It's absorbing the concept. It's large. It's a very big concept. And that's the idea. It was a big concept to close everything, and it's going to be a very large job to reopen it and to do it safely. And I understand why the governor's task force is trying to get it right and take their time and make sure, once again, they get it right. But
it's okay to say it stinks. Everyone forgets that. It's okay to say this is not fun. It stinks. I don't like it, and that's okay. It's okay to feel that way about it. I feel that way about it.
I just want to plan for it. And I know that is the common thing. Everyone involved in this entire endeavor. I mean, talking to people who haven't been working is one thing, but getting on a forum like this with people who never stopped working, you're trying to get your head around your actual day, your actual tasks and responsibility to the public. But now you have to also jump into the concept of every single opportunity to come onto the table without yet knowing what the governor's actual plan is. There is some great guidance out there, and as we digest it and start posting it, getting it up for business owners to see, that will be key, because the town's going to need to partner with every one of these businesses, and they're going to have to have a plan, and they're going to have to self-certify before they even go forward, if I'm not mistaken. They're going to have to commit to that plan.
I would think so.
Well, thank you very much. As we go around very quickly, last words for next week. Next week they could just be down to one forum as we see what these phases look like. If you had one sentence, two sentences to say to everybody to hold us for the next 7 days, Deputy Chief, what would you say?
Throw it up. My go-to.
Very good, Lieutenant. You're up.
Like Lisa said, sometimes we have to say the baby's ugly, and we just have to shut up and color and do our job. So be out there, follow the guidance and make it easy for us.
Thank you. Lisa, last words?
Everyone's responsible for their own personal safety. No one else can keep you safe if you don't keep you safe. The fire department can do an awesome job of getting you where you need to go. The police department can do an awesome job enforcing some sort of set of standards, but only you are there in every situation that you're in your life. So only you can really keep you safe.
Thank you. And I really do, as my last words, want to thank all three of you. Pembroke Emergency Management has been amazing through this, and I'm very, very proud of every single one of you. Thank you very much.
Thank you.
Thank you.
Thank you, Sabrina.
Absolutely. Thank you to every Pembroke resident who's shown us the patience that we needed as we go through this, because there have been more than their fair share of people asked to wait. and
Huge
asked
thanks to
hold
them.
on.
Huge thanks to them.
Absolutely. And for everybody who may be tuning in or asking or thinking or watching, yes, the recycling center is definitely in the top 10 things we're trying to hammer out
Yes.
right now, because your
Yes.
concerns have been heard. And again, thank you. And my last thank you goes to Julie at PACTV for hosting this forum. And I want to leave it with you, Julie. Thank you.
Thank you, Sabrina. And as we move forward, we will do whatever is necessary to help our towns get up-to-date information. Every day we date stamp when the show is actually recorded, and you can watch us again by going to pactv.org/Pembroke. You'll see all the Pembroke forums here. But whatever the town needs, and I've told this to Sabrina before we went on air today, if you need a special forum just on insurance, if you need a special forum on small business openings or restaurant openings, whatever it is, whatever information will help people go to the next step safely, we will be glad to partner with you on that. So thank you. Thank you to Pembroke. We will see you possibly next Tuesday at 9, Sabrina. I mean, I know it's voting
Tuesday at
day.
9.
It's
Yep,
voting
Tuesday,
day.
but we'll figure it out.
Yeah,
We
we'll
will
figure it out.
And
Yeah.
yeah, there's a small concern that we could be deputized. I don't know really what you're going to get Tuesday.
Okay.
But I plan to at least see you Tuesday.
Okay. Okay, so we'll do, if nothing else, we'll do a brief update. Don't forget that voting day is next Tuesday. Everything you could possibly need is on the Pembroke website, the town of Pembroke. Please do visit there for all kinds of information. Click on COVID-19 updates. And until next week, we will see you again. I'm Julie Thompson from PACTV. Please have a good and safe day.
Okay.